I think it's a good project. It's a good initiative, especially since the project aims at separating what is being done in the field from leadership. And that way you can have a more concentrated effort in grooming champions for reproductive health at a policy level rather than trying to implement services at a grassroots level as well as something at the top level, which usually becomes very strained for one project to handle. So I think it's a really good initiative. And I'm hopeful that you will be able to find many reproductive health champions over the 3 years for the project course. I think that women have been the drivers for change in the social sector for decades. A message for these women leaders is not to lose hope and to band together, because there's always a more powerful message that's portrayed when you are banded together and united on issues. The women who are in leadership positions need to now turn their attention towards convincing our male folk on what their responsibilities are in helping them become leaders for these issues as well, and not just relegated to just women's issues and that women leaders will only take care of women's issues. There's a very big responsibility for the men, and I think as women leaders we are all very susceptible to making room for them in this field and to helping the men become leaders in this field as well. I think that the mindset is also because we have to look at how much do we actually involve men in the reproductive health cycle. We have to educate men to let them know that they don't become a father from the day that the child is born. They are a father from the same time that a woman is a mother, from the time that she conceives. And they need to be part of the process while the child is growing inside of its mother. They need to be part of the process in making sure that the child is delivered in a healthy, safe environment for both the child and the mother. And they also need to be responsible for the health of the child and the mother after the delivery. So it's going to take some time, but we have to start talking about it. I think that there's a very big misconception in our country that the youth doesn't know about reproductive health. So I think that the first thing that we need to do is just accept that young people do know something or the other about reproductive health. And the second thing that we have to do is realize that since they do know something, we should make sure that what they know is healthy and safe and appropriate in our social-religious context. I think that the government needs to make family planning services available for them. As you know, we have a very high unmet need for contraceptives. Approximately 33% of young married couples who know about modern contraceptive methods do not have the services available to them. So these are the things that we can do. We need to target the populations that are wanting to use the services. So these are some very positive and interesting interventions that can be made. We need to look into it and bring the religious leaders on board and help them be the ones who deliver this kind of information so that it removes the barriers, the cultural and social barriers to access and utilization of services. At this point, it's kind of up in the air because, as you know, after the 18th Amendment, health is being devolved to the provinces and the Ministry of Population has already gone. I think that since the launch of the MDGs in 2000, the government of Pakistan has made tremendous efforts to address these issues. So the government has been proactive. I think that the government has restraints in the amount of money that they can allocate for programs. They've had problems with duplication, but hopefully post-devolution, the provinces will take care of the duplication issues and streamline the programs. I think that the government also needs to work a little bit better in creating awareness. It's very unclear how the communication strategies or advocacy strategies have worked in the past. And perhaps they need to revisit those strategies and come up with advocacy and behavioral change communication strategies that have better results than what we've seen in the past. The other thing is, I think, partnering with private sector organizations who are providing services and doing communications. And I think that through a collaborative effort, they'll be able to provide services to more people and at least get communications to a much more larger cohort of people than what we're seeing right now.
All right, thank you so much.
Thank you.